meeting. You're all welcome. Just to remind members to switch off mobile phones, as they will interfere with the recording equipment. Do members have any apologies? Okay, I'll take that as a note. Just a few items under Chair's business. Just to remind members that the committee is not meeting next week. That was to allow members to attend the political summit on the reform of health and social care service. Also, just to remind members that in place of a meeting on Wednesday the 24th of February, the committee will visit the North and West Protect Life Implementation Group in Doncairn Gardens in Belfast. I'm just going to ask members to complete. There's a pro forma on your tables, just indicating whether you're able to attend and if you require transport. Item 3 then is the draft minutes of the meeting on Wednesday the 3rd of February 2016, which are at page 6 of your meeting pack. Just to advise members that, as agreed at last week's meeting, the approved minutes, I'd approved the minutes so that they could be included in the bill report agreed at last week's meeting, so that has been processed. Item 4 then is the Commissioner for Older People's report, changing the culture of care departmental briefing. Just to remind members again that the departmental officials are here to brief us today on the timetable for implementation of the proposals in the Commissioner's report and to respond to the issues raised by the Office of the Commissioner in its correspondence of the 16th of December 2015. Just to refer members then to pages 15 to 76 of your meeting pack and to the Department's briefing paper, which was received yesterday and is on your tables. So you're very welcome. We've Chris Matthews, Director of Mental Health, Disability and Older People, Donna Ruddy, who's Head of Quality, Regulation, Policy and Legislation, and Jerome Dawson, Head of Elderly and Community Care. So I'm going to hand over to yourself. Is it yourself, Chris, that will make the opening remarks? Okay.
Thanks, Chair. We've been invited today to give a further update on actions being taken in the areas identified in the Cotney report, changing the culture of care provision in Northern Ireland. We last provided the committee with an oral briefing in late October and followed that up with a written timetable in November. So on that basis, rather than go through each of the proposals in turn, I thought it would probably be more helpful to give you an update on areas where we've made progress in the intervening period. Turning first to nursing, there are 3 areas of progress to report. First is the launch of the Return to Practice campaign, which went live last month. The campaign is designed to encourage nurses in Northern Ireland who have been out of practice to renew their professional registration and to return to nursing. As part of this, the Minister has prioritised funds for 100 places in the Return to Practice programme being delivered by the University of Ulster. This initiative is intended to support both the statutory and the independent sector. Second on nursing is the recently relaunched Career Pathway for Nurses and Midwives, and this is an online tool showcasing opportunities for development in a range of settings, including the independent sector. And thirdly on nursing, a nursing and midwifery workforce plan has now been drafted and is undergoing internal consideration and consultation within the department. Moving on now to the work being taken forward by the Health and Social Care Board. Its review of domiciliary care, which I think we mentioned last time, was published in November 2015. The report, A Managed Change, which has been published online, provides analysis of the current domiciliary care market, makes a series of recommendations for further work. And these recommendations cover a range of key areas, including oversight of the market and decision-making, investment of resources, costs and hourly rates, workforce planning, which, as we advised at our last appearance, is a piece of work already underway, procurement, technology and policy reform. On the issue of guidance for residents and their families, the Department has recently begun distributing printed guides on new standards for nursing homes, and these are being distributed both within homes themselves and to other stakeholders. In addition, a letter issued from the Chief Medical Officer on the 24th of November 2015, which drew the attention of the Trust to the new complaints processes in the revised Residential and Nursing Provider Specification and Contract, which itself was issued on the 27th of October 2015. In particular, this letter highlighted the need for Trust to ensure that providers review their complaints procedures on an annual basis, that any complaints made to providers are monitored, recorded and reviewed by Trusts, and this is in order to ensure that the process highlights trends and best practices shared between Trusts. I'm also able today to give you some updated statistics on the registration of the social care workforce. As of the 7th of January 2016, just under 24,000 workers had been registered, and as committee members may recall from our previous session, it's intended that when rollout is completed in March 2017, some 36,000 social care workers will be registered. Finally, as members will be aware, the Minister welcomed earlier this month the announcement that the Board was releasing a short-term support package of £1.6 million to provide resources to the care and nursing home sector, as well as for the domiciliary care sector. This is a measure intended to bring some confidence and stability into these markets and to provide some reassurance to residents and their families that the issues that are being raised both with the Board and the Minister will be given due attention. As the Minister has made clear, while these funds will undoubtedly help, there is more work to do, and this includes the setting of new care and nursing home tariffs for the 16 and 17 financial year. In closing, I hope this makes clear that work has been ongoing across the system and that good progress has been made in a relatively short period of time, and we're happy to take your questions.
Okay, thank you, Chris. I'm not sure I would share your analysis that there has been enough progress. In relation to this, and I mean, I suppose we need to make the point that the committee were concerned that this was formal guidance that was issued from the Commissioner's office to the department that was reflecting over a period of years and wasn't actually advanced or progressed with any degree of urgency, despite the fact that it was formal guidance to the department and to the Minister. But specifically, I suppose, just in relation to the very harsh learning that came from the Cherry Tree House review, have the department now accepted those, I think it was 22 recommendations completely?
Yeah, I mean, I think correct me if I'm wrong, guys, but I mean, I think the recommendations of Cherry Tree were accepted at the time. Our analysis of where we are on those 22 recommendations is that 13 are fully completed. There are 5 which relate to whistleblowing. And on those, so for example, recommendation 8 is on public interest disclosure. That's legislation that belongs to DEL, and it plans to introduce new legislation in autumn. And then Recs 9, 10, 11 and 14 are dealt with by the review we've commissioned the RQIA to take into whistleblowing itself.
So there are 13 out of the 22 that are completed?
That we would now say are completed, yeah.
Okay. And all of the other ones, are you suggesting that they are within the remit of other departments?
Well, there's one that would fall to DEL, and which has been actioned separately. There are, I think, probably 5 that fall to us, which we're discharging through RQIA and the review of whistleblowing. And then there's a further 4 that go to HSCB, and of those, probably they would say that 2 are complete. But, I mean, there's no question that we, of accepting those recommendations. I understand that they were accepted before even I took this position up.
And I suppose the question for wider society is, what assurances can be given that there are no more scandals like Cherry Tree House?
I mean, I think it's an assurance we would like to be able to give, but realistically, no one could ever give that assurance. I mean, we work hard, we take the lessons when something happens, we devise systems as best we can to prevent it, to avert it, to identify it when it's happening. But the truth is, no system is perfect, and no one can really give the assurance that nothing will ever happen again in the system. The only assurance we can give is that if anything does happen in the future, we'll respond to it quickly, and we will aim to prevent anything like it happening in the future. It's just not an assurance realistically we can give.
And I mean, it's a similar point then. Can you provide us information on, like, for how many homes, for example, would have had 2 or more failure to comply notices over the last, say, 5 years?
I mean, I think RQIA regularly publish performance statistics. I mean, Donna, I don't know if you want to...
Yeah, the RQIA publish on their website all enforcement actions, and I can go back to RQIA and ask them to provide the information that you requested over 5 years. It is on their website, but I could ask them to provide it in a letter to yourselves, if that's acceptable, Chair.
But I think the point is that the history of particularly Cherry Tree, but not Cherry Tree solely, where there was, in one nursing home in Belfast, there was 20 failure to comply and notices issued.
Sure.
There was something dramatic going on in the system.
I mean, and as I think, Claire, I think, touched on this point in October. I think, without wanting to speak for RQIA, I mean, I think they readily accept the issues that arose there and the actions that are necessary to prevent that from happening in the future. I think the difficulty with this is probably this kind of relates to the idea that there's a sense that there isn't enough enforcement action happening, or also that it's not being followed up with more sort of stringent enforcement or more stringent penalties. It's very difficult to know exactly what enforcement numbers should look like, because you don't have a model for building a sort of statistical analysis of, well, how many enforcement notices should there be and how many have we got and that sort of thing. The best really we can do is devise systems that act quickly when wrongdoing is uncovered, that there are mechanisms for whistleblowers to raise concerns with the regulator, that the regulator acts as strenuously as they feel is required in the circumstances. But it is a very complex, very difficult business, and there are always risks in making decisions around how far to push enforcement. Glenn, I'm sure, would be able to talk you much more eloquently through the process that they go, their risk management tools and all that sort of thing. But in the end, it's an operational decision for RQIA as to how they enforce.
I think in relation to, obviously, the Cherry Tree House review,
Sure.
there was an acceptance that there had been opportunities for RQIA to be more rigorous in terms of their approach, and there was a view expressed that they actually made limited use of enforcement powers.
I think, I mean, I've seen the view, the evidence given where people have said they don't make enough use of enforcement powers, and I think that'll form part of the review of the 2003 order, where we'll look at all the different sort of sanctions that they have at their disposal. And again, Glenn talked through the sort of escalation procedures in October and the sort of different levels that they can go to. And one of the things we can look at as well, whether there are some lower level sanctions that we can bring in. Because, I mean, the ultimate sanction obviously is deregistration. Now that is, in these terms, a nuclear option. You're closing down a house, all the residents have to move out. Now they will do it if it's required. But there is always that question in terms of the spectrum of response and how you escalate that up. Is there a need to have more lower level sanctions? And I think that's something the work on the 2003 order will look at to see whether there is anything in the current framework which is discouraging RQIA from taking action where they might have done. On the Cherry Tree point, I think everyone has accepted the lessons from that experience.
And do RQIA need more powers then?
I think that's what we're looking at the minute. I mean, I think Donna may be able to talk more about the 2003 order review.
Yeah, we acknowledge that there's gaps in the order as it stands. It's 13 years old, and we have set up a group to internally look at it, and we're working with RQI to identify those gaps and to try and improve it. And part of it is to look at the sanctions that would benefit the RQIA better.
And do we have a sense of what that would look like? Because I'm just mindful that, you know, we've had this information, the Cherry Tree report, and some of the data went over an 8-year period. We had the Commissioner's report, 2015. We've had Donaldson report, and there was a clear action in the Donaldson report about reviewing the current policy, for example, on whistleblowing and providing advice to the Minister. So we've had very clear directions.
Yeah.
I'm not sure if they have been actioned.
The review of whistleblowing, RQI took it on as an extra, as part of their review programme. It was built in, and it is due to complete in the first half of this year. So there's been some action on that. The review of the order is wider. It's a longer piece of work. It's a change to primary legislation, and it will take, 18 months for that to be completed. It's not something that we could do overnight, because there's quite a lot that we are looking at.
Yeah, but I suppose the issue here is that part of the failures in relation to the very stark report that Claire Keaton brought in front of us was in and around, not all of it, but it was in and around limited powers or almost inaction in relation to RQIA's role. So we're saying we've identified gaps. We're saying there needs to be a review of the Act, but ultimately we're saying that might not happen for 18 months. So there is a risk in the system that current levels of care aren't being...
Well, they are, The RQIA have advised me they reviewed their enforcement policy and procedures, and they have strengthened their quality assurance systems when an inspector has a concern. So they're able to do that themselves without any change to the legislation.
And how has that been translated? What impact is that having?
Well,
on
what
the
they've
ground?
done is that the outcome of an inspection is discussed with a senior inspector within the RQIA, and a joint decision is made. So it's more joint decisions, it's more quality assurance, possibly of the inspector that was in the home, and if they had any concerns raised. So it is strengthening the quality assurance of their inspection.
I think there are probably two aspects of this may be worth disaggregating, and one is this idea that the RQIA don't use the powers they have already often enough in terms of enforcement and sanctions. I think the difficulty with that is really knowing, well, what's the right number of sanctions? So all we have is the operational data from the number of sanctions the RQIA actually hand out and the number of enforcement actions they take. But it's difficult to see what you would compare that against. I mean, I've seen people compare it to other jurisdictions in the UK, but their care market's very different from ours. It doesn't function in the same way. It's difficult really to see that you would say, well, there should be more enforcement actions without having some kind of underlying analysis of, well, what's missing. I think the RQIA themselves, post-Cherry Tree, and just part of good practice, have had a look at how they make decisions and how they decide to follow up. And I think that work is helpful and useful. But allied to that, we need to look with the RQIA whether the legislation is inhibiting them from taking enforcement action. In other words, do they have too limited a range of options, which mean that very suddenly you find yourself taking action which could be disproportionate and harmful to residents, because at the end of all this is about the well-being of residents. And you might say that you might want to take some enforcement action, but if the only action available to you is to close the home, the harm that causes to the residents is maybe greater than the problem you're trying to fix. So that's part of the review of the 2003 order, is looking at whether RQIA is constrained in its ability to act because the legislation is out of date, it's outmoded, and doesn't give them enough room to manoeuvre. Now, primary legislation, it takes a long time. Would we like to be moving quicker? Absolutely would, but the process takes a long time between developing policy and consulting and instructing and bringing it before the Assembly. That's a long process. It's a careful process. It's not going to happen very quickly. But as Donna said, the RQIA themselves have had a look at what they can do within their operational gift to see whether there's anything they're missing or whether they can
Can you give us any, I mean, this is obviously a question for RQIA as well, but can you give us examples of where, you know, what was identified in Proposal 5 was that there was a limited use of enforcement?
Sure.
So can you, since that report, since the Cherry Tree House review, can you give us examples of how RQIA have strengthened that?
I think we could ask them maybe to talk you through how in practice it's affected decision making. I think the difficulty there is really every case has to be taken on its own merits. So even if there had been a change in enforcement action, you would have to be able to say that that wasn't because of some other change in the environment more widely. So whether you'd seen a general deterioration in behaviour of providers, for example. Now, that's just an example. I'm not saying there has been that. But when you're dealing with that kind of statistical analysis, you have to be very careful that you're showing a genuine causative link rather than just either correlation between two things or a general sense that something might be the case, but it's very difficult to demonstrate numerically that actually there isn't enough enforcement.
Well, can you maybe share more detail around that particular?
I think we can ask the RQIA to have a think about how they might explain that.
I get what you're saying to a point that you have to look at these, you know, almost case by case. But equally, there needs to be confidence in the system as well, in terms of level of care. So if we've identified that there was a gap in terms of limited use of enforcement, and you know, I'm hearing from yourself that they've looked at their own enforcement issues organisationally. I want to see what's happened there. Yeah,
I mean, I think probably to clarify, I'm not sure we necessarily think there is a gap in enforcement at the minute, anyway. And I think I suppose that's the point I'm trying to make, and the point you make as well, Chair, the need for care in this and the need to instill confidence. If there is a gap in enforcement, clearly we need to address it, but at the same time, if there isn't, then we need to close down that discussion as well, because we don't want people to think that the RQIA is in any way toothless or passive.
But I think that was clearly coming from the Commissioner's report, that there was almost a stepped approach to enforcement, that there was limited use of enforcement powers. So, there's an issue about limited use of enforcement, and then there's the issue about the Act itself, and do we need to change that? But it was very clear coming from Cherry Tree House and indeed the Commissioner's report that there was limited use.
I think that's certainly, yes, that came clearly from the Commissioner's Culture of Care report. And I think if that's something we can work with the RQIA to address, I think that's something we could usefully do.
But do you see just then in terms of the issue, which I think was proposal 1, which was raising minimum standards? Certainly there was a big emphasis on that from the Commissioner's report around, I suppose in a nutshell, why should we set standards at a minimum?
Okay.
Is there any more development around that or thinking within the department?
Well, as we sort of discussed in October, we have issued new nursing home standards. I think part of the discussion we had around that was, I suppose, the use of the term minimum standards. From our perspective, what we mean by minimum standards is essentially the minimum threshold below which enforcement action will follow. What we don't mean is that that's what providers should be aiming for. Now that's something I think we'll bear in mind then when we look at, I think we're currently working on care home standards at the minute. So I think that confusion or that discussion is something we need to bear in mind when we bring out the care home standards in due course, to make clear that what we're talking about by minimum standard is essentially the floor below which no supplier can fall and below which enforcement action will follow. Not that that is what we're saying people should aim for and that should be enough to get by. Really, we want providers to be providing very high standard, but necessarily in any regulatory regime you must have a minimum standard below which no one can be allowed to fall, and that's really what that refers to.
So nursing care standards were changed?
Yes.
But residential care is being examined currently? And is there a timeline on?
No, not as yet, Chair.
Are we talking months? Are we talking years? Are we talking?
It'll not. It will not be. It could be by the end of this year.
Okay.
We could.
And are we likely to? I know we can't confirm it completely, but are we likely to see the same type of approach to nursing care, or would we see something different in terms of the benchmark or standard that would be required?
The standards for the nursing care homes, they were developed through a very thorough process of engagement with the service users and all stakeholders. And the Commissioner for Older People welcomed the person-centred approach to the standards, the nursing care standards. And the new standards in the nursing care home include the standards which the Commissioner had mentioned in her report on dignity, rights and daily life. So the revised nursing care standards have changed dramatically from previous versions, and the residents were put at the centre of the process throughout. Their views were listened to and taken on board.
Well, I might just take issue with that, because certainly in relation to the minimum standards for residential and nursing homes, obviously you've alluded to consultation, but the reality is that issues like dignity is actually mentioned in residential homes and domiciliary care standards once, and human rights is also just mentioned once.
Well, the ones I was talking about were the nursing home standards, that they were the most recent ones that we have revised, and they cover dignity, rights and the daily life, quality of life for residents. Now we are looking at the residential home standards, and again I would say that they would also include what I've said before, what's in the nursing care home ones.
Okay. Okay, there's a number of people have indicated. Kieran first.
Thank you, Chair. Thank you very much for your presentation. And the Chair mentioned, she said that the Commissioner's report was a stark report. I would say, I would go further than that. I would say it was a horrendous report. I can remember we were sitting in this very room whenever the Commissioner delivered that, and there was so much work to be done. I appreciate you have given us an update on what you hope to do within the next near while, but do you think enough has been done? I mean, you're even talking about the cherry tree. There's another home in Kingsway, home in Dunbarry, which was also, there was a lot of unpleasant things happening there. Has that been sorted? I think there was a report due now on the outcome of that, the Kingsway home in Dunbarry. Do you know anything about that?
I think we have to write to on that.
That was another one that there was so much things happening that it was unbelievable. So you're not aware at this moment in time on the outcome of that report?
No.
Right, okay. The other one is, and we welcome the extra, was it 1.6 million that was put in. However, you know, there was concern, and I would be concerned about, you mentioned the new tariffs.
Yeah.
That's an important one in relation to, because certainly care home owners were saying to me that come the 1st of April with the introduction of the new living wage, it was going to put a lot of strain on their ability to provide. Mm-hmm. Can you give us assurance that, or what correspondence have you had with the private homeowner that they will be able to carry on, in fact, hopefully increase their capability after that?
I met recently with the Minister with the IHCP, so they represent independent providers, and they put across very forcefully the challenges they're facing, minimum wage, issues around recruiting nurses as well, which we've talked around as well. And so in part, I think conversations such as that with the Minister and with the Board led to this decision to prioritise the 1.6. But I think everybody recognised that was not going to deal with it fully. The next big action intervention will be the tariff. Now, under the law, the Board is required to take into account the minimum wage rise. So the negotiations now, I can't say much more than the negotiations with the IHCP have begun or will shortly begin, and that will go into developing a new tariff for the 16-17 period, and that tariff will necessarily need to take into account the increase in the minimum wage.
So you are telling the committee that the results of that meeting was fairly satisfactory?
I mean, the meeting with the Minister, I think the Minister was left with no doubt, first of all, the importance of the social care sector and in particular the domiciliary care workforce, and also the difficulties that they face. Yeah. He passed those concerns on to the Board, who were in parallel having conversations with the IHCP as well. And at present, where that discussion is discussing what the tariff will be. Now that tariff, I don't know exactly what the number will be, but that tariff essentially will be set for the coming year and will take into account the increase in the minimum wage. I can't tell you what that increase will be, but
the main thing is that it will enable the homeowners to keep going and to have new people come into their place rather than closures, because at the end of the day, if there's any closures, it falls back in the department to provide for those most vulnerable people in the society.
Absolutely, yeah. No, I mean, there's complete recognition from the perspective of the department that the independent sector are partners in delivering social care. There is no, also them, I mean, they are our delivery partners. We rely on them to deliver care, so we have to devise a system that supports them in doing that.
Okay, and finally, could I ask, you will be aware of the recent announcement that the Stewart Memorial Home in Bangor is to cease operation. Now, they have provided an excellent service for people, particularly with learning disabilities.
Yeah.
I mean, where are those people going to go? I mean, I've had people come to me and ask, where's my relatives, where's my loved ones going to go? Yes. What contingency plans have you made for the like of those people?
Well, the Trust is currently working with the residents to work out where they're going to go now. But there are plans in place.
Is that not a bit late in the day? I mean, this particular home had warned about a threatened closure long ago. There was some sort of consultations, and now people are being told it's closing, and there's no indication of where their loved one's going to be.
As I understand, I mean, this is a completely private. This isn't a home controlled by the trust.
Yeah, but I mean, they're catering for a severely learning disability people
right, yeah.
that we're all responsible for.
As I understand it, the formal announcement was made on the 28th of January, I think, that they were going to close. Now, that requires a 3 months notice period. In that 3 months, the trust will work with current residents and users to make sure that they're provided for in other facilities. Where that will be, it's too early to say, but the trust is working with current users to sort that out.
Okay, let's hope that they can, and the sooner the better, because as you can imagine, it causes so much anxiety for the people concerned. Yeah. Thank you, Chair.
Thank you. Joanne, next.
Thank you, Chair. Can I also thank you for your briefing? When the Chief Executive responded to the committee chair in detail on the time frame, I think it was back in December, she said, and I wrote down the quote at the time, whilst it is the Minister's prerogative to decline to implement advice given by the Commissioner, I would expect that the Commissioner should receive updates as to the progress towards implementation or other rationale as to why implementation was not feasible or practical.
Sure.
And I share Kieran's concerns. It was worrying, wouldn't even come close to how we felt when we heard that. Why was the information not forthcoming? Was the Commissioner being deliberately ignored? Why was that information not forthcoming?
It was never our intention to ignore the Commissioner. I think in our last evidence session we provided, and I think in this examples of times we wrote to the Commissioner with updates against each of their proposals.
You did read the Hansard, I'm sure, of the presentation back then.
I mean, I think, and we've had discussions as recently as December with the Commission, or the Office of the Commission. The Commissioner is now gone. If they feel we're not giving them enough information, I have to accept that. But all I've attempted to do in this session and in the previous sessions is provide examples of the updates we've been providing.
But you can understand how alarming for us it was to
Absolutely,
hear the
no,
Commissioner
absolutely.
say that.
Absolutely.
It is worrying because the Chief Executive went on to say that the Commissioner had not received any clear evidence that the Minister had accepted or rejected her advice in relation to the Culture of Care report in November 2014.
Okay.
I do find it particularly disturbing, given the nature of this report, that in leaving office, Ms Keating had to bring direction to her Chief Executive to continue to press for action on this advice. That is alarming. Are you concerned by this?
Well, I suppose my concern is that we're obviously missing something in the communication. I think in the evidence we've provided to this committee, I hope it makes clear while we maybe aren't as far ahead as you would like us to be or where we would like to be, it's certainly not the case that we have done nothing in this area. There is action against all of the areas that the company identified as requiring action. It's not the only report in this area, as you mentioned, as Donaldson talks about whistleblowing. There are other reports in sort of similar territory. I think I have to accept that the Commissioner feels that we haven't been communicating with them enough, or that we haven't taken enough action. But from our perspective, I feel like we have written to them regularly. We're providing regular updates to them and to this committee. We've met with them. I know RQIA have met with them. Obviously, there is some further issues, something they're expecting from us we're not providing.
It appeared there was no apparent will to respond to the recommendations, and I know Kieran and others were very, very alarmed by that. Can I then take it, in his letter to the Chair last week, the Minister confirmed, in his words, significant progress and a number of proposals, and stated that others were, in his words, more complex. Yeah. Can I focus on one of those issues which the Minister had said had been addressed, and that was Proposal 9 of the CPNI, because the Commissioner had said that they cannot understand how the Department can state that this had been addressed. So who do we believe?
Okay. Oh yeah, I think this. Yes, this is quite a complicated one because it deals with the sensitive contract law. I think this is essentially an issue of disentangling the different contractual arrangements people might find themselves in. So essentially there are three types of resident. So you're going to have the resident who pays everything for themselves in the contract. and therefore they have all the normal remedies available to someone under contract law. Then you have people who are maybe mainly funded by the state, under a contract between the trust and the provider, and then who maybe pay a top-up under a separate contract. Their remedies will be primarily under that contract for the top-up, and their other remedies will be through the trust, because the trust is the person who holds the contract. And then you have the residents who are wholly funded by the state, and again, that's governed by a contract between the trust and the provider, so their remedies again are through the trust. Now, in some of those cases, what I think the Commissioner refers to is sort of a refund under sort of normal consumer sort of provision. A refund will only be appropriate in those cases where there's already a contractual relationship. Another remedy might be more appropriate in those cases where the main contract or the main instrument is between the trust and the provider. So the person, if they have a dispute or a concern, as we've talked about, the newly issued contract should make it easier for residents to use the trust to deal with disputes and to feel more protected in doing so as well. I know there was some concern around unilateral actions by suppliers and all that sort of thing. But in essence, I think here is one of those areas where it's just quite complicated because there's different types of contract and different types of situation. But in essence, some people are entitled to a refund under ordinary contract law, and some people will need to pursue a remedy through the trust, if that makes sense.
The Minister had said it's been addressed, and yet the Commissioner said they cannot understand why the Department can state this has been
Yes, I mean, I
addressed.
think this is probably something we just need to talk through with the Commissioner again, because I think it's an issue that just needs to be disentangled. If there is a specific class of resident that we've missed in that analysis, in other words, if there's somebody who's left without a remedy, then I think it would be helpful to talk to the Commissioner and see. Absolutely, no. I mean,
do you recognise the concern?
I recognise there's a concern about that. I also recognise that people need to know if they have an issue, what their remedy is, and how they can exercise their rights. This is just one of those areas that's complicated, essentially, because of contract law.
Yeah, it's just, as I said, the Minister said it had been addressed, and obviously we're hearing the
I totally see where you're coming from, absolutely.
Okay. Finally, if I may, I know the Chair touched on this earlier, it's in relation to whistleblowing from relatives or from older people themselves. I know at constituency level, which is pretty common in some areas. Can you explain for us how, which as was pointed out by the Commissioner, the RQIA can conduct a review of the whistleblowing arrangements when they are an integral part of the system?
Well, I think probably it's because of their role in the system that it makes sense for them. They're the independent regulator of the sector. They are an organisation to whom whistleblowers should feel comfortable going. And they also have a perspective outside the department. In other words, their perspective is how can they best do their job rather than any interest in the sort of policy interests that we may have. So I think in that sense, because they are independent and because of that role, they're probably the best person to do it. They also have the experience operationally of whistleblowing and whistleblowers. And
no, I've had some experience with this recently, but they're, I'm at odds because they're an integral part of the system, and I know the Change in Culture of Care report recommended an independent local organisation would be better placed to support whistleblowers and therefore address their concerns. So does the department agree with this? Maybe
I think it's something that will be looked at as part of the review, but what I would say is there are some advantages to, and this is without prejudicing whatever RQA come up with, but just in general terms, there are advantages to creating a unitary body that does one function and is very visible. But one of the other issues you have about whistleblowing is knowing where to go and where to take your complaint. If you create new bits of the system and overcomplicate it, you may actually make it more difficult for people to report because you create a more complicated system. So it's one of the things you have to weigh up when you look at, well, how is it working at the minute? What are the barriers to people reporting things? Do we need to make it easier?
People are come to us as elected
absolutely, yeah, absolutely.
We need to know that impartiality is there, and
Yes, I mean, well, from that perspective, the RQI is completely independent from us. They are completely impartial. They will carry out their duties without fear or favour. We have no concerns about the independence of the RQI in that.
But you will take forward, maybe depend on their view, someone independent local, that will be considered?
Any whistleblower that comes forward at any point of the system will be taken seriously. So in a sense, it doesn't, if anyone reports anything to an elected official like yourself and that comes into the department, that gets fed into the proper channels. There's no, or there should be no barriers to whistleblowing.
I mean, with regard to an independent local organisation rather than, you know,
Yeah, I think it's something worth considering, but I think there are, from where I'm sitting now and thinking into the future, I can see as many disbenefits as benefits to it. Also, I mean, the resourcing point as well. We might not have the resources to sustain that kind of a body.
but I'd like to see it being explored.
I think it's absolutely worth exploring, yeah, absolutely.
Thanks, Chair.
Okay, thank you. Rosie had indicated.
For my other Caroline, thanks very much for the presentation. Can I just talk a wee bit more about the issue of contracts and the reassurances for older people, because it doesn't seem as if it's robust enough, the reassurance that older people, particularly in terms of tenancy terminations.
Yeah,
So
yeah.
can you give some reassurance that, you know, someone won't be evicted, or because what it actually just says is in the document that we got from the department is no placement would be terminated without provider engagement with the relevant trust.
Yeah.
Now, engagement doesn't actually tell you very much. It might be a talk about the weather.
Yeah, no, I appreciate that. I mean, essentially what that refers to is that there should be no eviction under the contract without some trust intervention. As an honest broker, as a protector of the older person's or the resident's rights, because the trust's primary interest is in their well-being and their care. So they should act in a way that is always guided by that. So the new contract and specification basically makes clear that no provider can simply evict someone without recourse to the trust, and that when the trust gets involved, their primary interest is in that person's well-being. So, I mean, there may well be cases where there's a complete breakdown in the relationship between the provider and the family, and they may mutually agree there needs to be a managed process here, but it should never be the case that a person is simply evicted without any recourse to the trust and without any right of reply to whatever's being put to them by the provider.
But is there an assurance that a person will not have their tenancy terminated without a suitable placement in another?
Oh yeah, no, absolutely. I mean, in the case of placements in another home, yeah, I mean the trust would,
placement.
yeah, I mean the trust would work to avoid any sort of harm in that sense. But in terms of just sort of arbitrary or the fear of capricious terminations, the trust should always intervene to prevent that. And it should, a supplier would be in breach of contract if they ever simply terminated somebody's tenancy.
And would you know anything about the Ballyone process and how that is going?
I don't, but I can look into it for you.
Could you? Because, I mean, I know that was earmarked for closure, and I just haven't had any more feedback as to how that's working out.
Yeah, I can look into that for you.
Okay. Can I ask also about, in terms of penalties in the document, it was saying about withholding of fees or the return of fees where the service was less than what it should be, or it fell down in terms of standards. And I mean, there was responses in terms of the residents who would maybe have benefits, but for self-funders, it seemed like there was no, there's no real recourse to have refunds where their services fell down, even though they would be paying.
Yeah, I think, I mean, so I think the earlier discussion sort of touched on this. I think for self-funders, it's the ordinary contract law provides them with protections. So if you're paying for a service under contract and you don't get that service, then you have all the normal recourse under the law to refund or renegotiation. Or where it gets complicated is where either you have someone who's paying a top-up because their care is partially managed under a contract between the trust and the provider and their own contract. So working out the dynamic between which bits they're paying for and which bits the state is paying for. And then you have people who are wholly funded by the state for whom there may be no mechanism to provide a refund because they've not spent their own money. But they have an issue and they have rights and they should have right to redress. And that has to be done through the trust, under the trust contract with the provider.
Yeah, but I mean, it doesn't seem right that people who are self-funders don't have protection, because it might create some instability or it might be complicated.
No, they do have protection under the contract that they've signed.
Yeah, but I mean, according to what I'm reading, it seems as if it's up to them to sort it out with the owner.
Well, I mean, I think, yes, because they have a private contract with a provider, and the trust has no involvement in that. The trust might not know that they've made that contract. They won't be aware of their care.
I mean, there should be some sort of protection there. There should be.
Beyond the protections under contract law.
Yeah, it doesn't seem right that an older person whose service has fallen down and who pays for that,
Okay.
and then it might destabilise the home if, you know, you have to go to a lot of bother to refund them.
I see what you mean. I think it's something we can look into. I mean, they would obviously be able to report the provider to the regulator, obviously then instruct a solicitor to enforce the contract. But it might...
Yeah, because ultimately what you need is penalties to take place so that the standards will rise. That's what it's really about. It's not about getting your own back. It's about actually ensuring that the standards are what they should be, so that then people shouldn't have to ask for a refund because the services will be, you know, as they should be.
Yeah, I mean, I think that's ideally what you're describing there is the balance you seek to strike between due process for providers, so you have a regulator that is taken seriously, that people have confidence in, and that the providers just do what they're meant to. Obviously, there is at the minute some concern that we haven't quite got that right, that the regulatory framework isn't tough enough, that the regulator isn't taking enough action. I think that's something we just need to work to look at, the 2003 order, to look at the regulations as well for care homes, but also I think to begin providing evidence to reassure this committee and others that we do have an effective regulator, that we have generally a good care home market and a good nursing care home market. But I think where you have something like Cherry Tree or other very horrendous and very, very terrible things that happen, you need to deal with them very quickly and very convincingly to sort of, I think, dispel the kind of concerns that lie around. You know, you hear about one Cherry Tree more than you hear about 200 good homes.
Yeah,
The bad news travels very, very quickly, and good news doesn't really travel at all. And I think that's just something we have to be very conscious of.
Yeah, but a concern also is the fact that the sort of penalties or the regulations only kick in whenever something falls below minimum standard. So,
Sure.
like, minimum standard then is the absolute lowest that would be provided. So something has to fall below that.
Yeah.
I think the bar needs to be higher. There has to be. I mean, what way is that regulated? Is it really, well, let's wait and see if they fall below minimum standards? Who wants to be in that position, that you have to be at the lowest of the low, really, before regulation kicks in?
I mean, I don't think we would say that the minimum standard is in any way bad. I mean, I think it's that we wouldn't say that it's the only standard people should aim for. Obviously, we want providers to provide the best possible standard, but the minimum standard is calibrated that it's the necessary minimum that we would expect anyone to provide and be providing a good service. It can be better than that, and we would never try to cap anyone in being better than that, and different homes will have different approaches to how they approach that. But really, the minimum standards deal with, say, things like staffing numbers and that kind of thing. There's a kind of a minimum threshold of operational provision that is required in order to meet the regulatory standard. So I wouldn't want to give the impression that this is in some way some really low-tier, terrible sort of home, and it has to be rock bottom before anyone intervenes. I mean, the RQIA do frequently issue notices and say, right, you need more staff, or you didn't have a manager on this day, or, you know, that kind of thing. And their website has all of those notifications up for people to see. But there is an interesting conversation to have, I think, about standards and how they rise year on year, and also, you know, how we pay for that. Obviously, rising standard leads to rising costs and all those other pressures in the system as well. So there is, and we have mentioned before, we've got this review of adult social care looking into the longer term, and to look at things like standards, to look at things like what social care is for, and how we pay for it, and all that sort of thing. But our regulatory approach is key to that, because that's the guarantee for citizens that here is the standard you can expect in a home, and it should never be below that. And if it is, we'll take action about it. But that standard is not to say it's that will be a home operating at that standard will be a bad home. It's really to say, right, that is the minimum standard. There will be better homes. And people have choice as well. I mean, people can choose to go to other homes. They can look at the RQIA reports and they can choose which home they want to go to, and they can, make an informed decision. Now, there's more provision in some areas than others, and people maybe have an idea of the home they want to go to as well. But the way we're trying to organise the system is on the basis of choice as well. So better homes will have more residents and more motivation to raise standards.
And in terms, is there a commitment or an intention to improve the inspections of RQIA so that there'd be more unannounced, longer inspections, speaking to more people, night inspections, just dropping in rather than planned inspections?
I mean, as I think Glenn briefed in October, I think they've moved to unannounced inspections now. So they are, and I think Donna may be able to give more detail, but they have moved to unannounced inspections now.
Yeah, they were, I think, 50% of their inspections were unannounced, and they've now increased that to 80%.
How many? 80%?
80% of the care homes.
So is that the intention, and that's where the bar is? It'll be 80%?
Yeah, but they will not move to all unannounced inspections because there is value in announced inspections. But yes, they have increased on the number of unannounced inspections.
Okay, so you're saying it's 80% then?
It was 80. They provided me with figures because they weren't able to attend themselves today. But I can come back to the committee just to clarify that, but
Okay.
they did provide what they were at and what they've increased to.
And those unannounced inspections, would the intention be that they would be like comprehensive, like not just drop in and...
Oh no, they're full inspections
Full
that they would
inspections.
carry out, yes.
Okay, all right, thank you.
Okay, thank you, Rosie. Okay, just a few comments by way of action coming from this. If we could, you indicated about the review of the order, and that's been like an 18-month potentially process. Asking that you would keep us informed as
Absolutely.
that is developed. One of the other issues was, and there was, cross-party support in relation to this, about the need for legislation to actually protect older people from abuse.
Yes.
Is there any intent in the department to...
Well, at the minute, we're still, a new policy on adult safeguarding was issued, I think it was the summer last year. So we're currently still evaluating the impact of that to determine whether there is a need for a new criminal offence, as recommended by the Commissioner. Obviously, criminal offences sit with the DOJ, so it would be a piece of work we'd have to take forward with them. But at this stage, it's not ruled out, but we're not clear yet how the policy is worked out, so we're not clear yet. We need to legislate. As I said before, because primary legislation takes so long, it's something that we would like to be clear that it's something that is going to have the kind of impact we need, because there are limited slots for taking forward primary legislation, and you just need to be clear that it's a good use of the Assembly's time and the sort of time will be allowed to a bill. But it's not been ruled out.
Well, that's good to know that it's not ruled out, because I suppose in terms of the good use of the Assembly's time, it was, the reporting of abuse had increased dramatically.
Yeah.
And there was clearly a need to have a very clear definition of what abuse is,
Sure.
because increasingly abuse could have been many things in relation to, not only physical or sexual, but financial abuse as well. So, again, there was cross-party support for that proposal on the floor of the House, and I think it's certainly something that we should be actively pursuing.
Yeah, and I think that one of the alternative ways to approach this is to look at there are a number of offences already on the statute book, offences against the person, pecuniary offences, and that sort of thing. If we were able to find and provide guidance on the use of existing offences, that's obviously preferable, assuming that the penalties are there and it gets us the policy outcome we want. That's much quicker than providing a new offence. So I think really what we're looking at is whether we can use the existing criminal law, and there are very many offences against the person and very many sort of financial crimes and fraud and that sort of thing. And if we were able to provide guidance to the relevant people about the best offences to use, and we were able to get the policy outcome in that way, it would be preferable to be able to rely on the existing criminal law rather than to bring forward a new offence. But if we can't do that, obviously, then we will be back to a new criminal offence.
But you're effectively saying that the ongoing work around adult safeguarding, there won't be a decision taken in terms of further legislative requirements until...
It'll be the next session before I think we reach a view on that.
Okay. Okay, well look, I mean, there was a few things that we were requesting, the review of the order in terms of updates on that. We'd also talked about the examples of better use of enforcement powers from the RQIA post Cherry Tree House and post the Commissioner's report as well. And then obviously in relation to the legislation and going forward, appreciate an update from the department as to their thinking around that.
Sure.
And I think that was the key thing. So can I thank you for your time today?
Thank you.
Thank you. Okay, members, moving on. The next item, item 5, is statutory rule. The Animal Feed Compensation Market and Use Regulations 2016. It's at pages 78 to 93 of your meeting pack. Just to remind members that we had considered and approved the SL1 for the rule on our meeting on the 15th of April 2015. There's been no changes to the policy content since the SL1 was submitted to the committee, and the Examiner of Statutory Rules has yet to report on the rule. So are members content with the statutory rule?
Right.
Therefore, the Committee for Health, Social Services and Public Safety has considered SR 2016-4, the Animal Feed Regulations 2016, and has no objection to the rule, subject to the report of the Examiner of Statutory Rules. Item 6 is another statutory rule, the Animal Feed Hygiene Sampling, etc. and Enforcement Regulations, pages 95 to 124 of your meeting pack. Again, we had considered and approved the SL1 for this rule at our meeting on the 15th of April 2015. No changes to policy content since the SL1 was submitted to the committee, and the Examiner of Statutory Rules has yet to report on the rule. So again, if members are content with the rule,
Great.
the Committee for Health, Social Services and Public Safety has considered SR 2016-5, the Animal Feed Regulations 2016, and has no objection to the rule, subject to the report of the Examiner of Statutory Rules. And item 7 is another statutory rule, the Firefighters Pension Scheme, Consequential Provisions Amendment Regulations 2016, and it's at page 125 to 133 of your meeting pack. Again, we had considered and approved the SL1 for the rule at our meeting on the 27th of January 2016. No changes, again, to policy content, and since that was submitted to the committee, the Examiner of Statutory Rules has yet to report. So if members are content, I would put the motion that the Committee for Health, Social Services and Public Safety has considered the Firefighters Pension Scheme and has no objection to the rule, subject to the report of Examiner of Statutory Rules. Item 8 is a statutory rule, the Health Service Workers Consequential Provisions Amendment Regulations 2016, and it's page 135 to 142 of your meeting pack. Again, we had considered and approved the SL1 for the rule at our meeting on the 3rd of February. There's been no changes to policy content since it was submitted to the committee, and the Examiner of Statutory Rules is yet to report. So if members are content, I would put the motion: the Committee for Health, Social Services and Public Safety has considered the Health Service Workers' Consequential Provisions and has no objection to the rule, subject to the report of the Examiner of Statutory Rules. Item 9 is another statutory rule, the Misuse of Drugs Amendment Regulations 2016. Just seeking agreement to add the Misuse of Drugs Amendment Regulations 2016 to the agenda as item number 14 and to consider it at that stage.
Great.
So just want to refer members to the table pack for the relevant papers and to remind members that the committee considered and approved the SL1 for the rule at our meeting on the 3rd of February 2016. There's been no changes to policy content, and the Examiner of Statutory Rules has yet to report. So if members are content with the statutory rule, then the Committee for Health, Social Services and Public Safety has considered the Misuse of Drugs Amendment Regulations 2016 and has no objection to the rule, subject to the report of the Examiner of Statutory Rules. The next item is the Forward Work Programme. Just to refer members to page 144 to 145 of your meeting pack, and I'm just asking members to note.
Great.
Item 11, Matters Arising. There are 3 items under Matters Arising at pages 147 to 150. Are members content to note?
Chair, could I just, on the 147 one, I think that's, well, contained in that is some useful information in that those of us that visited that clinic were shocked at the cramped conditions they were working in, if you can recall. And will this committee forward or advise those people of what's contained in this letter?
Yes, I think it would be useful to send that back. I raised this issue during the week as well, and the letter from the Minister talks about, I'm trying to just bring it up here, a long-term solution.
Yeah.
So I would do 2 things. I would forward the letter back onto the Trust following our visit, and also seek an update on progression on the long-term solution.
Yeah.
And just track this as it moves on, because there's no doubt there's significant work being carried out in the clinic, and they are doing it under very, very difficult physical conditions there as well. So, yes, absolutely. Okay, any other matters arising?
No, it's all right. It's for
Okay.
any other business.
Okay, item 12 then is correspondence. 3 items of correspondence, which are page 152 to 175 of your pack. Are members content to note the correspondence?
Great.
And item 13, any other business? Pam?
Yeah, Chair, thank you. Kieran and I both attended the APG on autism yesterday, and I had mentioned that I would bring up with this committee whether this committee could kind of recommend their legacy report, that the issue of the autism bill and its implementation and all the questions that have been asked by the APG are considered, that would be taken forward in some form of mention in our legacy report going forward to any future committee. So it was just really to see if this committee would agree to highlight the autism bill and its implementation and the need for that to happen really in its legacy report.
Okay, yes, so it's effectively, what the request is so that we would as a committee would highlight the autism report going through back to the department. It's on this, yeah?
No, it's a different issue.
Okay, so are members in agreement that we do that?
Absolutely.
Okay, Sarah, was it, go ahead.
I attended an event last night, and it was Hope for ME. It was sponsored by Joanne, and it's the issue about this PACE funding, £5 million, and a lot of the people are very critical, and what they're saying is detrimental to the recovery of people with ME and fibromyalgia. But one of the things that came out in a presentation was that there's this treatment called a lightning process, and people are very critical of it. And there was an apparent claim that it was endorsed by the Health and Social Care Board. So could we write to the department to ask if do they endorse and recommend the lightning process as treatment for sufferers of ME and fibromyalgia?
Okay, committee content to write
Great.
to the department in relation to that specific detail? Okay, thank you, members. Okay, then, just date, time and place of next meeting, which is Wednesday the 2nd of March 2016 at 2 p.m. in the Senate chamber. Thank you.
Program signed.